Hello, good evening, everyone. Welcome to the webinar on the topic of chronic stress, why it matters, and what to do about it. My name is Dr. Denisa Millette, and I will be hosting you at this webinar today. Um, so first of all, I want to say thank you so much for being here with me tonight, for taking a moment from your Tuesday to be here. Okay, so if you don't know me, my name again is Dr. Denisa Millette. I am an Atlanta-based licensed psychotherapist. I'm also a certified clinical trauma professional and a clinical supervisor, which really means that I am helping to train other professionals towards their licensure in counseling as therapists. I have over 20 years of experience in the field of clinical and forensic counseling and performance psychology. And I'm also a professor of psychology at a Yorkville University in Canada. So I teach online, but I teach master degree students. If you want to know or learn anything more about the work that I do, I would encourage you to visit my website, which is really just my first and last name, denisamillette.com. About Denisa, but you can kind of look around the website to learn more about my work and um, my experience. So let's look at the agenda today, what we're going to talk about today. So we are going to do, again, we only have 30 minutes on a really huge topic of chronic stress. So we're going to do a little bit of an overview in terms of why it matters to really understand chronic stress. We're going to look at the different types of stressors. We're going to look at symptoms of chronic stress. We will talk a little bit about what the general adaptation syndrome is all about. And then we're going to look at some very specific stress-induced illnesses. And then in the second part of this webinar, we're going to talk about what to do about it. Because once we identify the symptoms and we understand the causes and all about that, we need to look at the coping strategies. We will very briefly touch on some of the basic foundational things, such as healthy lifestyle choices, mindfulness and relaxation technique, and social support. But also, we will actually do some of the hands-on. So we're gonna learn how to do a physiological side, how to practice a 5, 4, 3, 2, 1 grounding technique, and we will finish with a progressive muscle relaxation. So I'm really excited to get into it with you and do this with you so that you have an understanding, but you also have a chance to do some hands-on work and learn how to reduce some of the difficult symptoms of stress. So let's get right into it. So let's start with just talking about what is stress. So there's a nice and handy definition on the slide for you. Stress is a complex condition with physical, mental, and emotional dimensions. It is often described as a response to a perceived, and the word perceived is really a key word here, threat or challenge, resulting in a state of tension or worry. So biologically, stress is really a biological response that involves chemicals and hormones surging throughout your body, preparing you to either face the challenge or flee from it. In terms of your psychology, it can really cause mental tension, leading to feelings of anxiety, depression, or negative thoughts about oneself or the world. Physically, stress can manifest as symptoms like headaches, sleeplessness, and can even be a factor in causing autoimmune disorders and diseases. And then lastly, in terms of emotional aspects, emotionally, stress can lead to irritability, anger, or fatigue. But we're going to look at these a little bit more as we go through this presentation. So one of the things that's really important is to differentiate between the positive versus negative stress. So let's look at the positive stress or the eustress. So in an essence, eustress is really short term and it's perceived as something that is within our coping skills, coping abilities. It keeps us motivated and excited about life. It helps to improve our performance and resilience. It's kind of like that feeling that you get when you're challenged in a way that is invigorating and rewarding. On the other hand, negative stress or distress is typically long term and is perceived outside of your coping abilities. So, this is the type of the stress that feels very draining and exhausting and often results in anxiety, depression, and decreased performance. It's the kind of the stress that comes from being overworked or facing unrealistic expectations or dealing with really prolonged difficulties. So, why is this important? Well, it's important for you to recognize the difference between these two types of stress so that you can actually manage them effectively. Because positive stress can sort of be harnessed to push you towards your goals, while negative stress should be addressed and mitigated to make sure that you prevent long term impacts on your well being. The other differentiation that we need to do is to look at acute stress versus chronic stress. So, in terms of the acute stress, so what does that mean? So, it means it's really short term and it's the body's immediate response to a perceived challenge, event, or demand. It shows up as heart palpitation, shortness of breath, feeling lightheaded, headache, stomach pain, sweating. I'm sure all of you have experienced acute stress before. Some of the examples of this are a near miss car accident or preparing for an important presentation. I had some acute stress today as I was trying to figure out how to work the YouTube channel. Um, in terms of the chronic stress, so it's the opposite. So chronic stress is really long term. It builds up over time. Sometimes it can last for months, sometimes even for years. So what do we see as common symptoms? Anxiety disorders, irritability, depression, fatigue, physical health issues. A lot of times it's for a lot of people, high blood pressure, heart disease, all kinds of pains and aches. Examples could be ongoing issues such as, really difficult job environment, financial hardship, and a lot of times some toxic, unhealthy relationships. So, what's important to know here is that while acute stress can actually sometimes be beneficial by boosting energy and improving your memory, chronic stress is really harmful, especially if it persists and can lead to some very serious health concerns. All right, so let's look at some of the common types of stressors. So, internal stressors are the stressors that originate from within your own mind and your thoughts. So, they are related to your psychological mindset, they're related to your expectation and sort of self imposed pressures. So, examples of the internal stressors include inability to accept uncertainty, really feeling anxious when faced with unknown outcomes, negative self talk, criticizing yourself. We all have that inner critic talking to us, pessimism, constantly expecting negative outcomes. But also unrealistic expectation, which means really setting, impossibly high standards, rigid thinking and lack of flexibility, which a lot of times translates into just being resistant to change, kind of like not really accepting the fact that change is completely inevitable. And really, the only control we have is how we change, not whether we change or not. And then all or nothing thinking, really seeing situations as either completely perfect or total failures. The second type of stressors are external stressors. So these are the stressors that really come from external forces in your environment. So these are events or circumstances that you cannot easily control. So some of these examples are major life events or life changes, such as the death of a loved one, a divorce, a career shift. Those would all belong in there. Work related pressures like really urgent deadlines, job demands, pay cuts, that goes in that category. Relationship difficulties, any kind of conflicts or trust issues within relationships, financial worries, debt, bills, inflation, unexpected expenses, being too busy, multitasking all the time, juggling multiple responsibilities and family responsibilities. So this could be, taking care of your children, taking care of aging parents, having an overbooked schedule all of the time. So what's important though, even though we can separate them, it's important to remember that both internal and external stressors can have very similar physical and psychological effects. So, identifying the source of your stress, and it can be more than one for sure, will allow you to then work towards a healthier and more relaxed mental state. So, that's where it has to start. It has to start with the realization, okay, I'm experiencing certain symptoms. What are my stressors? Where are these symptoms coming from? Because only then we can actually deal with them. Okay, so let's look at some actual symptoms of chronic stress a little bit more in depth. So, chronic stress can really manifest through a variety of symptoms that affect both the body and the mind. So, it is a mistake to work just with the cognition, just with the mind, or just with the body. In order to heal and recover from the impact of chronic stress, we really need to work with both. But let's look at some physical symptoms. So, aches and pains. So a lot of times, a lot of people really struggle with very persistent muscle tension that creates a lot of discomfort and pain in the body. I know a lot of people complain about stiffness in the neck, issues with cervical spine, issues with low back. I know also a lot of women carry tension in their hip joints. That's all belongs into this aches and pains category. Fatigue, really just feeling tired all the time, regardless of how much sleep a person has gotten. Difficulty sleeping, and this could be insomnia or any kind of disturbed sleep patterns. Oops, didn't want to go there yet. Okay, gastrointestinal changes. So, what does this mean? A lot of times it means nausea and stomach pain. And for some people, it's diarrhea. And for some people, it's constipation. It could really be a lot of different things. Headaches, frequent headaches, chronic headaches, decreased energy, and of course, weakened immune system, which will then lead to frequent infection, illnesses, and potentially even, oh my goodness, I'm just jumping those slides. And potentially even development of autoimmune disorders. Okay, let's look at some of these psychological symptoms. So, a lot of times we see things such as irritability or difficulty concentrating, having memory lapses, having trouble really focusing or even making decisions, lots of rapid, disorganized thoughts or rumination, feelings of helplessness and hopelessness, low self esteem, really not feeling so great about myself, not lack of confidence and really kind of a negative self perception, loss of sexual desire. Also, for a lot of people, just kind of decreased interest in sexual activity and nervousness and tearfulness, which is oftentimes a pervasive, persistent anxiety and sadness. And then, behavioral changes that we see are changes in appetite, either eating too much or too little. Again, difficulty making decisions, reliance on unhealthy coping mechanism, which really means a lot of times substance use, alcohol use, heavy alcohol use, and then restlessness or nail biting. So this is kind of a time to think about, if you recognize some of these symptoms, because again, you can be experiencing one or all. It doesn't really matter. I think what's really important to recognize is that these symptoms can really vary when it comes to severity from person to person because we have a different resilience, we have different genetical makeup, we handle stress differently. But when it's pervasive and when it's long lasting, what happens is that sometimes people grow somewhat accustomed to it. It begins to feel normal. It's normal for me to have a low back pain. It's normal for me to be always on edge. It's normal for me to be tearful or having trouble focusing or making decisions. So, but what's important is that recognizing these symptoms is really, like I said, the first step towards managing stress effectively. So, again, if you are experiencing several of these symptoms, it may be beneficial for you to seek professional help and to develop some strategies of how to cope with these symptoms and how to manage stress effectively. Okay, let's talk briefly about the general adaptation syndrome because I think this is a very important piece of knowledge. And again, some of you may recognize some of these stages. So the GAS or the general adaptation syndrome was proposed by the endocrinologist Hansel, who it really who described this as the reaction of our bodies or response to our bodies to stress. So it consists of three different stages. The very first stage is the alarm reaction stage. So this is the very initial stage. Your body experiences the immediate symptoms when you're facing stress. So you might recognize this as the fight or flight response. So the sympathetic nervous system is activated. It leads to an increased heart rate, the release of stress hormone, cortisol, and adrenaline, and overall heightened energy levels. So the physical signs during this stage sometimes are dilated pupils, rapid breathing, heart palpitation, trembling, and overall heightened senses. So once we go through that stage, we move on to stage two, which is the resistance stage. So after the initial shock of stress, your body begins to repair itself. So cortisol levels decrease, your heart rate and blood pressure normalize. But if the stressor persists, your body remains on high alert. It continues to secrete stress hormones and blood pressure can stay elevated. So some stressful situation may, continue for extended periods of time and your body just kind of adapts to coping with stress. But there are limitations on it because after being at the resistance stage for some time, we do reach what's called the exhaustion stage. And in the exhaustion stage, if the stress is not resolved, like I said, your body eventually reaches the state of exhaustion. So what happens is overall disturbance across different systems of the body. So we see that the prolonged high stress levels can really disturb the immune, digestive, cardiovascular, sleep, and reproductive systems in the body. So again, it leads us back to what we've been talking all throughout, that identifying these stages, identifying the symptoms, um, and managing the stress are such crucial steps towards preventing really negative, long lasting effects. And the next slide, when I move on to, is going to show some of the specific stress induced illnesses that are, scary to see, but very realistic. It's a very real threat. And I think this is something that everybody should be aware and know about. So one of them is what we call the broken heart syndrome or Takotsubo syndrome, which really, severe stress can cause temporary weakening and dysfunction of the heart's left ventricle, which can lead to some very serious complications, such as this condition. Stress induced ischemia to the heart, where stress can decrease blood flow to the heart, which will result in chest pain, heart attacks or heart ischemia. And then, high blood pressure. Obviously, everybody knows about chronic stress causing raising blood pressure and increasing the risk of heart disease. Um, but beyond the cardiovascular issues, we also see stress-induced hyperglycemia, which is really elevated blood sugar, but also respiratory issues such as asthma, ulcers, but also things such as clinical depression. So very, very concerning illnesses and conditions that could all be prevented just by effective chronic stress management. Right. So we have done a very kind of a quick overview of why chronic stress matters. And now, as we move into part two and this, very kind of a brief webinar, we are going to talk about what to do about it. So there are really three types of strategies. And I'm going to, sort of mention them just briefly. Many of them are very well known, very well researched, really mentioned everywhere. But I think that it's important to think of them and be reminded of them. And some of them are not so well known, and we get to practice some of those today. So we're going to look at three types. We're going to look at healthy lifestyle choices. We're going to look at mindfulness and relaxation techniques, and we're going to look at social support and boundaries. Okay, so healthy lifestyle choices, I think these are such basic foundations. As a matter of fact, when I work with my clients in individual therapy, and people come and they want to do trauma processing and all of that, and I will not start the trauma processing part of trauma focused psychotherapy until I know that there are some significant changes in the lifestyle, especially regarding physical activity, healthy diet, and sleep hygiene. So, in terms of the physical activity, we're really talking about just regular exercise because we do know, based on a lot of research out there, that it will reduce stress hormones and improve your mood. Choosing any activity that you really love and enjoy doing, whether it's walking, dancing, biking, yoga, whatever it may be, and trying to do it, some type of a movement for 30 minutes a day is a lifesaver, literally. Also spending time outdoors, soaking the sun, fresh air, being in nature, being in contact with nature, huge in really helping managing symptoms of chronic stress. Healthy eating. So, I think it's given that eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, avoiding excessive caffeine, alcohol, and sugary food, and hydrating your body from the moment you wake up throughout the day until you go down, very, very essential. And sleep hygiene. I could do an entire webinar really just focused on sleep hygiene. So I just put three main points, which is maintaining consistent sleep schedule, going to the bed at the same time every night and getting up at the same time every morning, having a really calming bedtime routine and avoiding screens before bed, creating a dark and quiet sleep environment. Just these three will make a significant difference. So our attention today will be more on the mindfulness and relaxation techniques. I'm going to teach you some very specific techniques, but in general, what belongs in this category is deep breathing, really breathing through your diaphragm, and not through your lungs. A lot of people make a mistake of engaging in chest breathing and really just breathing just through your lungs and not through your diaphragm, which will not activate the response that we need. So, just really briefly, when we are working on a breath work, what we're trying to do is activate the vagus nerve. The vagus nerve is the longest cranial nerve in your body. In fact, it's so long, it goes from the back of your head all the way down. It wraps itself around the internal organs. And so so when you take a deep breath in, and you really enlarge your diaphragm through your brain, there's a pressure that's applied onto the vagus nerve, which sends the relaxation response all the way up to your brain. And then your brain responds back and the body relaxes. And that's why diaphragmatic breathing really works. If I am slouched down and doing a very superficial chestal breathing, I could be sitting and breathing like that all day and nothing is going to happen. So remember, no matter what kind of a breathing technique you're going to employ, what kind of a breath count you're going to employ, unless you're sitting straight, your chest is open, you're moving your body, you're opening your body, the breathing technique is not going to work. Very, very, very important. Meditation, setting aside just a few minutes daily for mindfulness meditation. This could be so many different things. Please don't think that meditation has to be you're just sitting down and, crisscross applesauce, closing your eyes and meditating. Mindfulness could look like taking a moment to eat your lunch or dinner and doing nothing else and enjoy every taste and breathing and tasting and relaxing with your food. So many different forms of this. Um, and then lastly, progressive muscle relaxation. So this is really only one technique that I mentioned here. There are many others, but I mentioned it here because we are going to be doing this practice here today together. Moving on. Okay, and last, very important as well, social support and boundaries. Okay. So, in terms of social support, talking it out, sharing your feelings with trusted friend or family members, so important when it comes to stress management. Joining a group, connecting with other people who are facing similar challenges, or even, going to therapy and talking to your therapist, whether it's cognitive behavioral therapy, whether it's dialectic, or acceptance commitment therapy. Like all of these therapies really work on a reframing thoughts and managing stress. And then, of course, time management, really prioritizing tasks, breaking them into smaller steps and focusing on one thing at a time as opposed to multitasking. And then learning to say no, setting boundaries, and knowing that it's okay for you to decline additional commitments. Okay, so let's practice. So, the very first technique that I wanted to share with you today is what we call the physiological sigh. Okay, so physiological sigh is a breathing exercise that is extremely effective because it quickly reduces stress and anxiety, like on the spot. So it involves a pattern of breathing that consists of 2 inhales through the nose, followed by a long exhale through the mouth. So this technique reinflates the alveoli in the lungs, which can collapse and then compromise the oxygen and carbon dioxide exchange. Okay. So the physiological sigh is really a great and effective way to alleviate stress in real time without having to disengage from whatever activity you may be doing. So, in other words, you don't have to leave, you don't have to stop anything, you do it right then and there. So, this is how we do it. I would love for you to do it with me. I cannot see any of you, you can only see me. So, please be comfortable trying this with me. But pretty much what you do is you're going to take a deep inhale through your nose, followed by another short inhale on top of it, like we're topping it up. And then we're going to exhale with our mouth and we're going to purse the lips as if blowing up the candle on a birthday cake. Okay. So here we go. I'm going to do it with you. So deep breath in, another one on top. And now let's do it one more time. Deep inhale through your nose, another one on top. This particular technique is so effective that for most people, you only need to repeat maybe 1 or 2 times for it to be effective and to help restore a sense of calm and improve your mood. Okay. So, Please try this when you need it. Remember it. I think it's really helpful and effective. So that's physiological side. If you struggle with things like a panic disorder or really severe anxiety, it's a good idea to sometimes use this as a, breathwork practice where you sit up a couple minutes and you practicing this breathing. Okay, our second technique is going to be the grounding technique, 5, 4, 3, 2, 1. So, grounding techniques are really coping strategies that help you reconnect with the present moment, especially during an escalation when there's really high stress or high anxiety. So, these grounding techniques really help to um, calm down distressing emotions and dysregulation and really refocus your attention. So with this particular technique, I sort of enhance this technique from its original because I like to start just with an overall body awareness. So let's try it together. So start with taking 5 long, deep breaths through your nose and then exhaling out through your mouth. And again, try to use the puckered lips. And as you are breathing, go ahead and place both feet flat on the floor. Apply some pressure and wiggle your toes. Sometimes it's a good idea to even stomp your feet on the ground several times. Just really pay attention to the sensation. And when you're done, go ahead and clench your hands into fists and release. And clench and release. You can do it up to 10 times. If you have a little stress ball, you can use the stress ball to squeeze and release. And then press your palms together, pressing harder and holding this pose for about 15 seconds. So notice we're breathing, we grounded our feet, we felt our toes and the bottom of our feet stumping the floor. We clenched and released, and then we pressed our palms together. So we are really aware of our bodies. And now we're going to engage our senses. So we're going to start with, oh, what's that? So we're going to start with just paying attention and seeing and naming 5 things in your environment. So slowly look around and just name any random 5 things in your environment. Take your time. And then when you're done naming the things that you see, I want you to feel 4 things. Okay. So this could be any kind of a sensation like clothing on your body or how the chair feels that you're sitting on. But it could also be just touching a surface of anything next to you, rubbing with your hands, really noticing the texture of 4 different things. And then we are going to move on to hearing 3 things. So now take a moment and just listen. Can you identify 3 different sounds? So you're hearing my voice. That could be one. What else are you hearing? The sounds that you normally ignore. Traffic, outside your window, somebody cutting grass. And then smell. So technically, you should be smelling 2 things. So that might not always be possible, but just try to notice if there's any odor in your air, in your room, in your environment, candle, food, anything, laundry, air freshener, anything that you could potentially smell. And the last one is taste. So I oftentimes recommend to my clients to carry a candy or a gum or mint or something, piece of chocolate in their bag that they can put in their mouth when they need to get grounded to really stimulate the sense of taste. Sometimes the intensity of whatever we're tasting is really helpful. So slice of lemon can be really, really helpful because your brain focuses on what's happening right here, right now, as opposed to what's going on in the environment. Super spicy mint or cinnamon gum, those types of things are really, really effective. So this is a great grounding technique when it just gets too much and the mind and the body need a little break and calming down. All right, very good. And we are moving on to our last technique, which is the progressive muscle relaxation. So I would like to invite you now to do this meditation, brief meditation practice with me. So go ahead and make yourself nice and comfortable. You can close your eyes. You do not need to see anything, or you can keep them open. Just kind of choose a spot on the wall or on a carpet or anywhere you want to. Just softly gaze at the spot. Take a nice deep breath. We are going to do this progressive muscle relaxation, which is a exercise that reduces stress and anxiety in your body just by having you slowly tense and then relax each muscles to really bring on almost immediate sense of relaxation in the body. But it's best to practice this frequently. And so I want to do this now with you. So pay special attention how the sensing the tension and then the release of the tension in each muscle causes a relaxation. So go ahead, close your eyes if you're comfortable to do so, and begin by taking a deep breath and noticing the feeling of air filling your lungs. And just hold your breath for a second on top. And when you're ready, just release the breath slowly and let the tension leave your body. And taking another deep breath and hold it. And again, slowly release the air. And even slower now, take another breath. Fill your lungs, hold the air, and slowly release the breath. And we're going to start with moving your attention to your feet. So begin by tensing your feet, by curling your toes and the arch of your foot. Hold on to the tension. Notice what it feels like. Hold it, and release the tension in your foot. Notice the new feeling of relaxation. And next, begin to focus on your lower leg. Tense the muscles in your calves. Hold them tightly and pay attention to the feeling of tension. And release the tension from your lower legs. Again, notice the feeling of relaxation. Remember to continue taking deep breath throughout this practice. Next, tense the muscles of your upper legs and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel tenseness without going to the point of strain. And release. Feel the tension leave your muscles. And begin to tense your stomach and chest. You can do this by sucking your stomach in, kind of like you want your belly button to touch your spine. Squeeze harder, hold the tension a little bit longer, and release the tension. Just really allow your body to go limp. Let yourself notice the feelings of relaxation. Continue taking deep breath. Breathe in slowly. Noticing the air fill your lungs. Hold it. And to release the air slowly. Really feel it leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can without straining and keep holding. And release the tension from your back. Feel the tension slowly leaving your body. A new feeling of relaxation. Notice how different your body feels when you actually allow it to relax. Tense your arms all the way from your hands to your shoulders. Make a fist and squeeze all the way up your arm and hold it. And release the tension from your arms and shoulders. Notice the feeling of relaxation in your fingers, hands, arms, and shoulders. Notice how your arms feel limp and at ease. And move up to your neck and your head. Tense your face and your neck by distorting your eyes and mouth, the muscles. So open your jaw and scrunch up your eyes and scrunch up your nose. Really, really, really feel the tension. And then release the tension from your face. Good. Yeah, notice the new feeling of relaxation. And finally, try to tense your entire body. Tense your feet, your legs, your stomach, your chest, arms, head, neck. Tense harder and stronger, but without straining, and hold the tension. And release. Allow your whole body to go limp. Pay attention to the feeling of relaxation and how very different it is from the feeling of tension. Begin to wake your body up slowly by gently moving your muscles, adjusting your arms and legs, stretching your muscles, and slowly blinking your eyes open when you are ready. So, progressive muscle relaxation is just one of the very de stressing meditation practices. I actually recorded this meditation a little bit longer because I only had limited time with you today. But I recorded a longer version of this meditation. If you go on YouTube, and here is the channel to look for, you will find the recorded meditation for the progressive muscle relaxation alongside with other ones. I have maybe 6 or 7 meditations that I put up there for my individual clients. But you can find it there if you want to practice independently. Okay. And the last thing really that I want to share with you today is the upcoming event that I have, which is called the Empowered Relief, Train Your Brain Away from Pain. So this event is in connection to chronic stress, to this webinar on chronic stress, because oftentimes, one of the symptoms of chronic stress is the development of chronic pain. I know many people, I know many of my clients struggle with chronic pain due to autoimmune disorders or other health issues in the body. And I attended a very specialized training with Stanford School of Medicine in really learning how to manage chronic pain using psychology and behavioral medicine. So I'm going to be hosting a 2 hour long class. It's going to be a similar format to this one, where I'm going to be sharing a presentation and do some really great hand-on activities. And it's going to take a place on Thursday, May 16th at 7 p.m. There is a registration. It's going to be on Zoom again. So you can just go to my website and look for the chronic pain tab. You can email me, you can contact me if you cannot find it, but this link right there, denisamilettejourney.com, which stands for the Empowered Relief, is where you can register and sign up for this event. I'm excited about it. And that is really it. So thank you so much. Again, here's my website. Here's my phone number. You can also email with any questions. It's really just info@denisamillette.com. I want to thank you again for being here tonight, taking some time from your busy day to learn and to practice with me. I hope this was helpful to you. And I hope to see you in the Empowered Relief or some other upcoming seminar. Thank you, everybody.